Which is the only hepatitis virus that is a DNA virus? Hepatitis B virus, HBV. The Dane particle seen on electron microscopy refers to which viral pathogen? Complete virion of hepatitis B virus. HBsAg persistence for more than 2 months defines chronic HBV infection. 6 months. Speak prosody rate 120%. Genome of influenza A virus is composed of how many RNA segments? Antigenic shift in influenza requires co-infection of a cell by at least ... different strains. 2. Oseltamivir and zanamivir inhibit which viral surface enzyme? Neuraminidase. The live attenuated measles vaccine is given at 9 months in India to avoid interference by which antibody class? Maternal IgG. Subacute sclerosing panencephalitis is a late complication of infection with which virus? Measles virus. Councilman bodies in hepatic histology are classically associated with which viral hepatitis? Hepatitis B, also yellow fever. Diagnosis of congenital CMV infection requires detection of virus in urine within 3 weeks of birth. Ganciclovir resistance in CMV is most often due to mutation in which viral gene? UL97, phosphotransferase. The window period of HBV infection is best detected by which serological marker? Anti-HBc IgM. Rabies virus entry into neurons is mediated by binding to which receptor on the cell surface? Nicotinic acetylcholine receptor. For Category 3 animal bite, number of rabies vaccine doses recommended in the updated Thai Red Cross schedule is 4. 0, 3, 7, 14 days. Which DNA virus replicates entirely in the cytoplasm of host cells? Pox virus, e.g. variola, vaccinia. Guarneri bodies are intracytoplasmic inclusion bodies seen in infections with virus, pox virus. The torch complex of congenital infections includes toxoplasma, rubella, CMV, HSV, and Treponema pallidum, syphilis. Slat cheek rash is typical of infection with which parvovirus serotype? Parvovirus B19. JC virus causes progressive multifocal leukoencephalopathy in patients with severe deficiency of which lymphocyte subset? CD4 plus T cells. The sicular rash in a dermatomal distribution in adults is due to reactivation of which virus? Varicella zoster virus. Which antiviral drug is used for preemptive therapy against CMV in transplant recipients? Ganciclovir or valganciclovir. Rotavirus vaccine currently in India's UIP is based on which reassortant strain? 116E, Rotavac. Dumb rabies denotes rabies with predominant paralysis, ascending flaccid. Post-exposure hepatitis B prophylaxis combines vaccine with HBig at different sites when the source is positive and the exposed person is unvaccinated or non-responder. Speak of prosody rate increasingly 20%. The confirmatory test for HIV after 2 reactive screening tests in India is Western blot, or a third different ELISA/rapid, as per NACO. Integrase strand transfer inhibitors such as dolutegravir block insertion of viral DNA into host genome of which virus? HIV-1 and HIV-2. Which oncogenic DNA virus expresses E6 and E7 proteins that inactivate P53 and RB? Human papillomavirus, high-risk types 16, 18. Kissing lesions on opposing skin surfaces are characteristic of infection with virus. Herpes simplex virus. Cowdrey type A intranuclear inclusions are pathognomonic of which viral group? Herpes viridae, HSV, VZV. A single-stranded RNA virus with reverse transcriptase but lacking oncogenes belongs to which genus? Lentivirus, HIV, for accidental needle stick from known HBsAg positive source. HBIg dose is approximately 10,000 IU per kilogram body weight, 0.06 IU. The bite of Aedes aegypti transmits dengue. Which viral protein is targeted by NS1 antigen Elisea? Non-structural protein 1. Dengue hemorrhagic fever pathogenesis involves antibody-dependent enhancement mediated by which immunoglobulin class? Non-neutralizing IgG from prior infection. Hepatitis D virus requires the envelope proteins of HBV. The HDV genome is what type of RNA? Circular, single-stranded, negative-sense RNA. Polio eliminated in India was verified in year by WHO. 2014. Sabin oral polio vaccine carries risk of VAPP mainly due to reversion in which serotype? Type 2, PV2. Rhinovirus preferentially grows at 33 degrees Celsius because its primary replication site is the nasal mucosa, upper respiratory tract. Which arbovirus causes microcephaly and Guillain-Barré syndrome outbreaks? Zika virus. Japanese encephalitis vaccine SA-1414-2 is administered subcutaneously at months of age in India, 9 months, with a booster at 16 to 24 months. Hepatitis C virus lacks proofreading in its RNA polymerase, leading to quasi-species and escape from various immunity. Humoral neutralizing antibody. Direct-acting antivirals for HCV genotype 3 in India include sofosbuvir plus inhibitor. Velpatasvir, NS5A inhibitor. Which picornavirus uniquely causes pancreatitis and diabetes in children? Coxsackie B virus. The incubation period of yellow fever is typically 6 days, 3 to 6 days. Breakbone fever is an alternative name for viral infection, dengue. EBV latent membrane protein 1 transforms B cells by activating which signaling pathway? NF-kappa B. A heterophile antibody Paul Banel test becomes positive in infectious mononucleosis caused by virus, Epstein-Barr virus. Acyclovir requires phosphorylation by which viral enzyme to become active? Viral thymidine kinase, HSV, VZV. First DNA virus proved to cause human cancer, MCC, is polyomavirus, Merkel cell polyomavirus. Kaposi sarcoma is linked to infection with which herpes virus type? HHV8. Hendra and Nipah viruses belong to which genus under Paramyxoviridae? Henipavirus. Hydrophobia and aerophobia in rabies are due to spasms of which muscle groups? Pharyngeal and inspiratory muscles. Post-exposure prophylaxis with varicella-zoster immunoglobulin must be given within 96 hours of exposure. ELISA detecting P24 antigen can identify HIV infection approximately how many days earlier than antibody tests? 7 to 10 days earlier. Genome of Coronaviridae is unique because it is the largest among RNA viruses and is stranded. Single-stranded, positive sense. Remdesivir is a nucleotide analog that inhibits viral polymerase, RNA-dependent RNA. Rabies virus bullet-shaped morphology is due to the arrangement of protein, matrix M protein. Which enveloped DNA virus exits the cell by budding through nuclear membrane rather than plasma membrane? Herpes viruses. Cytoplasmic inclusions in Negri bodies consist predominantly of which viral nucleoprotein? Rabies nucleocapsid protein. ALK 4469 letermovir is approved for prophylaxis against infection in HSCT recipients. CMV, cytomegalovirus. Flaviviridae member without an arthropod vector is virus. Hepatitis C virus. Rabies vaccine potency in India is measured in IU. Each dose contains at least X IU per 0.5 milliliters, greater than 2.5 IU. Oral acyclovir is ineffective in CMV because CMV lacks functional enzyme, thymidine kinase. The eclipse period in viral replication refers to time between and appearance of mature virions, uncoding, disassembly. Rule of 6, genome length multiple of 6, applies to efficient replication of which viral family? Heteromyxovirity, e.g., measles. Reye syndrome is linked with aspirin use in children infected with this virus. Influenza B, also influenza A, varicella. Which virus has an ambisense genome with both positive and negative polarity on the same RNA segment? Arenaviruses, e.g. Lassa. Virus neutralization test is considered a gold standard for measuring immunity after vaccination against poliovirus. Hepatitis E outbreaks in India are most frequently due to genotype 1. Salk polio vaccine induces high levels of type-specific antibodies. IgG, serum neutralizing. Poxvirus replication requires viral DNA-dependent RNA polymerase because replication occurs in the host cell, cytoplasm. Exanthemus subtitum, roseola infantum in infants is caused by which human herpes virus? HHV6B and HHV7. Lipid solvents such as ether inactivate which category of viruses preferentially? Enveloped viruses. Which paramyxovirus lacks hemagglutinin neuraminidase activity? Respiratory syncytial virus. Genital warts are most commonly associated with HPV types and 6 and 11. Monkeypox virus belongs to the same genus as variola. The genus name is orthopoxvirus. Frederick Twort discovered bacteriophages. They are classified into families by morphology of tail structure, ICTV classification. P24 antigen corresponds to which structural protein of HIV? Capsid protein of GAG gene. The standard WHO algorithm for HIV diagnosis uses 3 tests with different formats and antigens. 3 sequential tests. Marburg virus and Ebola virus belong to which virus family? Filoviridae. The principal reservoir for hantavirus causing HPS is which animal? Rodents, deer mouse. Live attenuated oral adenovirus vaccine protects military recruits against serotypes 1 and 2, type 4 and type 7. Parainfluenza virus type 3 causes severe, in infants, bronchiolitis and pneumonia. Which oncogenic RNA virus carries a TAX gene and causes adult T-cell leukemia/lymphoma? HTLV1. First antiviral approved for treatment of RSV infection in high-risk infants, ribavirin, aerosol. LAMP, loop-mediated isothermal amplification test for SARS-CoV-2, amplifies which target gene most commonly? N gene, nucleocapsid. Aleutian mink disease is caused by a virus belonging to same family as human virus. Parvovirus B19, Parvoviridae. Virus hemagglutination inhibition test requires RBCs from which species for influenza A? Turkey or chicken, fowl, RBCs. The 17D live vaccine provides lifelong protection against yellow fever. In India, JE surveillance case definition uses fever with altered sensorium lasting greater than _hours, greater than or equal to 24 hours. Genome editing CRISPR-Cas, derived from bacterial immunity, defends against infection. Bacteriophage, viral. First licensed HPV vaccine in India, Gardasil, is 1-valent. Quadrivalent, type 6, 11, 16, 18. Rabies diagnosis in animals uses direct fluorescent antibody to detect antigen in which brain part? Brainstem or hippocampus cerebellum. Reverse genetics can recreate recombinant viruses. It was first described for which negative sense RNA virus? Influenza A virus. Hepatitis A vaccine is recommended for children greater than 25 months in Indian private sector schedule. 12 months. Neutralizing antibody titer equals 10 MIU per milliliter after HPV vaccination is considered responder, protective adequate responder. The crown-like morphology of coronavirus is due to which structural glycoprotein? Spike S protein. Rubella infection during first trimester can cause PDA, cataracts, and, in fetus, sensorineural deafness. Alphavirus transmitted by chick mosquitoes causing arthralgia epidemic in India 2006, chikungunya virus. Genome of SARS-CoV-2 encodes RNA-dependent RNA polymerase in ORF1b, NSP12. The only licensed dengue vaccine, CYD-TDV Dengvaxia, is based on chimeric backbone of which virus? Yellow fever 17D strain.